Today we're going to demonstrate how to do a safe spinal turn on somebody with an unstable spinal fracture. In order to do a turn you need 5 people. First person is at the neck and is in control of the turn. The second person is at the shoulders and chest. The third person is at the waist and pelvis. The fourth person is at the knee and lower leg, and the fifth person of the team is responsible for checking the alignment once we've done the turn and for tracking pressure sores and doing any kind of nursing care that we are doing the turn for, such as changing the sheets or bowel care. So firstly, don't put your hands on the bed like I've just done, but we would ask my person who's the chest person to put their hands on the shoulders and push down to apply counter traction. So when I'm sliding my hands around her neck and down onto her thoracic spine, she doesn't shift. So being very careful not to move her head or neck while I'm doing that. And once I've got a good hold, counter traction comes off and the rest of the people place their hands at the appropriate level. First in underneath the shoulder, being careful not to adjust your hand to make sure you don't move the spine, then one at the waist, then the next hand is next to that at the hip with the hand going underneath the upper knee. The next hand is the lower part of the knee, and the last is the ankle and heel. The instruction will be ready, steady, roll, and we will go to 90 degrees. Is everybody ready?
Yes.
Ready, steady, roll.
I'm now going to check that the patient's in alignment, and if they're not in alignment, just gently tap and let the staff know to raise or lower the leg. Don't mention it because you don't want to make the patient anxious. This is now a good opportunity to check all pressure areas the whole way down, and please don't forget natal cleft.
When you turn back, it's ready, steady, back. Is everyone ready?
Yes.
Ready, steady, back. At the end of the turn, hands come out from the bottom up. Leaving me is the person who's holding the neck. I do not let go until we've checked the alignment between the nose, sternum and symphysis pubis to make sure that the patient is straight. Michelle?
Her hips are slightly out.
So in this case, her right hip is slightly rotated up, so we're going to adjust very gently her pelvis to put her back into alignment. You do this by sliding your hands in under the pelvis, and it's a very gentle flesh adjustment. It's not moving the pelvis. What you need to be certain about here is that the two people doing the shift know who's pulling and who's pushing.
I'm pushing.
And I'm pulling.
And it will be on shift. Are you ready?
Yes.
Yes.
Ready, steady, shift. Perfect. And once that's done, hands out, take the hands down, and again check alignment. It's now in perfect alignment. I'll ask for counter traction to be applied. And I will slide my hands out, and that's a safe spinal turn.
We are now going to demonstrate how to safely transfer a patient to another bed surface using a spinal scoop. This is the spinal scoop that we use at UCLH.
So we're now going to place our patient on a spinal scoop in order to move them safely from one bed surface to another. We'll do a turn and turn to 45 degrees. Is everyone ready?
Yes.
Ready, steady, roll. And we'll go back on back. Ready, steady, back. And take your hands out. The other half of the scoop will be placed. If we do turn from the other side, please. Hello. Hands in. To insert the second half of the spinal scoop, we're going to do a small tilt in the other direction. Is everybody ready?
Yes.
We go on turn, ready, steady, turn. Once the Ferno board's complete, you place a sliding sheet underneath the spinal scoop. Quick as you like, ladies. Quick. And push it as far under the board as possible. We'll then turn back. So is everyone ready?
Yes.
Ready, steady, back. Hands out and transfer around the other side. And hands in. A very small turn to the left. Is everyone ready?
Yes.
Ready, steady, turn. And ready, steady, back. And hands out. Once the patient's on a spinal scoop and a slide sheet, it is easy to move the patient safely in any direction in the bed and of course across onto another bed surface, as we'll now demonstrate. So I keep hold of her neck to make sure it's stable. Hands on, and we're going to move to my right. Ready, steady, shift. Ready, steady, shift, left. Ready, steady, shift down the bed. Ready, shift down. Ready, shift up. This method is used to transfer the patient onto another bed surface with the pat slide and is very safe.